Hi, make sure you watch till the end for the mnemonic. These are the 2026 guidelines for treatment of juvenile idiopathic arthritis. First, let's set some ground rules. If a child is sick, mom is hands down the biggest protector. So, mom is equal to biologics mostly. IL-1 and IL-6 targeted. The other biologics like TNF inhibitors and abatacept are our aunties that we love so much. Then we have dad, who is equal to conventional DMARDs, like methotrexate. Then we have the targeted synthetic D, MARDs like JAK inhibitors, which are the siblings. Then let's call glucocorticoids grandma, because grandma is always there for mom, and let's call nonsteroidals grandpa. Starting with treatment for systemic, JIA without macrophage activation syndrome. The strongest recommendation is for biologics targeting IL-1 and IL-6 aka MOM, followed by use of conventional DMARDs like methotrexate aka DAD. This is followed by initial monotherapy using NSAIDs, aka Grandpa, and the last one being use of oral glucocorticoids, aka Grandma. If, however, these do not work, the next thing that we go to is the use of synthetic targeted DMARDs, for example, JAK inhibitors, aka our siblings. After well-controlled systemic symptoms in order to treat residual arthritis, the recommendations recommend methotrexate, which the next one is the treatment for systemic JIA with macrophage activation syndrome. Now, this, as we know, is an emergent condition. So here we have with us, not just mom, but also grandma to support mom. So we start with biologics and glucocorticoids. If they don't respond to that, we can call on our aunties and siblings to help out. So in conclusion, for systemic JIA, we are going to take help from the adults of the house first. And if that is not enough, we consult the siblings and the aunties. And if macrophage activation syndrome is also present, we go to the females of the family who are good under pressure, and we consult mom and grandma. And then, if ineffective, we turn to the aunties. I hope this helps you memorize the guidelines for the treatment of systemic JIA. Thank you. Follow for more.